To find out how quickly what you eat affects your body, Dr. John McDougall is here to explain just, I guess, how amazed we should be. How quick is it?
Tell me, have you ever known people who decided to skip lunch because they noticed they got sleepy and sluggish after they ate?
I have.
All right. Now, what I want to do is I want to explain to you what happens. If you sit down and eat a high-fat meal, that fat in that meal has a direct impact upon how your blood flows. Now, I want to show you something here on the screen, and this is very important for you to watch. What we have is we have the blood circulation flowing here very rapidly. And it goes through the blood vessels, and the blood cells, they hit and they bounce off each other, and they don't stick at all.
The way it should be.
Yeah, that's the way it's supposed to be. That's normal circulation. Now, these tapes that you're looking at here are taken from guinea pigs, but we see the same thing in people when we look through the whites of their eyes. Now, when you feed them a diet that has 67% of the calories as fat, then what you see is the circulation sticking together and sludging. And as a result, the blood flow is much decreased to the tissues. And what happens is you actually decrease the amount of oxygen in the blood by about 20%.
That looks like rush hour now.
This sludging effect lasts for hours. And actually, the blood doesn't return to normal for about 10 to 12 hours. So what happens is somebody sits down and eats a typical American diet. Their blood cells stick together. They feel sleepy and sluggish. Well, that's, a day-to-day impact. But can you imagine what would happen if you took somebody who had narrowed arteries to their heart or to their brain, and you caused the blood to sludge like this? What happens is people get chest pain, and they also get little tiny strokes as a result of that. So it's very important that we take and we feed patients who are sick from these diseases a healthy diet. And that's a low-fat diet. Well, that's a diet that has lots of rice and potatoes and keeps things like dairy products and meat products and even vegetable oils to a minimum. Otherwise, what happens is you get this sludging of the circulation and a serious compromise in the patient's health. Now, it's unfortunate, Lena, that if you have a friend or a relative that goes in the hospital and suffers a heart attack, that often the meal that they're served the next morning is one too high in fat content that could actually have an effect on the outcome of the patient. But people are learning about this. I mean, after all, we've come a long way in the study of heart disease. People know about cholesterol, and they're learning about fat. And pretty soon they're going to understand the immediate effect of what you eat upon the circulation, and proper changes are taking place.
And if you have the option between skipping lunch and having a high-fat lunch, skip lunch?
Well, I got a better idea for you. Have something like a low-fat soup or a sandwich that skips the butter and skips the cheese and instead has sliced tomatoes and lettuce on it. That's the way to go.
Okay, I will remember that at lunchtime today.